Breast cancer. Do you know your risk profile? Many women don't. We're here today to find out about a simple, straightforward test that's helping women better understand if they might develop this life-threatening disease. Joining me today, a distinguished panel of medical experts bringing a multidisciplinary approach to this vital health topic. We have OBGYN Dr. Eric Jacoby, radiologist Dr. Kathy Schilling, and breast specialist Dr. Owen Winsett. Good morning.
Good morning.
Thank you so much for being here.
I appreciate it.
Doctor, let me start with you, Dr. Jacoby. From an OBGYN perspective, what should women with maybe little or maybe no history of breast cancer in their family, what should they do?
Well, it's important to understand that 1 in 8 women will develop breast cancer. And
no matter what?
No matter what.
Okay.
And 80% of those women will have no significant family history.
Really?
So there's a false sense of security for a lot of women out there. So it's very important that they're proactive in their breast health. Get your annual mammograms, do your self-breast exams monthly, and also keep a healthy lifestyle. You know, decrease your alcohol consumption, eat right, and keep a good body weight as well.
And Dr. Schilling, what are the survival rates for early detection, let's say, versus survival rates for those who are diagnosed at later ages?
You know, the prognosis for women who have early breast cancer is really excellent. If you had 100 women diagnosed with breast cancer today, 5 years from today, 95 of them would be still alive.
Really?
Yes. But if patients are detected later with larger cancers, cancers that may have spread elsewhere, maybe only 40 of them would be alive 5 years from today. The bottom line is early detection is what's key. And we have early detection because we have good screening mammography, which has been the only test that's been able to identify cancers and really reduce the patient's risk of dying from breast cancer by up to 30 to 40%. What's interesting to know is that breast cancers are in the breast growing for 7 years prior to becoming palpable. And so we have a huge window of opportunity if we use mammography to find them before they are larger and more aggressive.
Dr. Winsett, let me bring you in now. What are some of the current challenges facing the medical community, if you will, when it comes to risk management?
Well, part of the problem with risk management is that it takes time. It takes understanding both on the part of the person who is getting the risk test and the people who are giving her risk assessment. And also the intimidation for both the office and the person receiving the information of having a potentially high result. Unfortunately, very few of us in medicine are, in fact, trained in risk assessment or even giving plans as to what to do about an increased risk. Fortunately, we in my office get to give people a low risk most of the time. But we have a breast health plan that we're able to give people who are at higher risk.
And do you feel women are proactive enough, if I may ask?
Well, quite honestly, no.
And that's a shame, because we're hearing so much about it.
Prevention requires action.
Yes.
And it requires knowledge about it, and it uses up our resources as well. And we need to be able to find out the ones who are the highest risk so that we can expend our resources there and change the outcome of that patient so that we can reduce that number.
Please stay where you are, because when we come back, we're going to look at a new proactive technology changing the way the medical community and patients deal with the risk of developing breast cancer. Really important information. Stay right there. Welcome back, everybody. Before the break, I mentioned a new technology having an impact on understanding your own risk of developing breast cancer. Doctor, let me start with you again. Tell me about this test and what difference it makes.
Okay, well, it's called the Brevigen test, and I have one here to show you what it looks like. And all it is a gentle, quick swab of the patient's cheek, and it gets the patient's DNA. And what that does is it enables us to look at 7 different DNA variants that have been associated with a higher risk of developing a breast cancer.
Really?
Yes. And using that and their clinical information from their history, we can tell them what their risk will be more accurately than it would be with just their clinical information alone.
But how precise is it as opposed to, let's say, other methods?
Well, it's much more accurate because, again, we're incorporating their genetics and their clinical history, not just their family history. And so, therefore, we can tell them what their 5-year and lifetime risk of developing a breast cancer is and see if they're in that high-risk category where they need more surveillance and possibly intervention.
And it's so easy to do.
Painless and quick and easy.
And that's a lot of that's a lot of concern sometimes. Well, what do I have to do? That's so easy.
Exactly.
And could save your life. Dr. Winsett, who should maybe think about doing something like this?
The people who should think about this are the ones that are 35 years old or older.
Okay.
Anyone who's had a breast biopsy of any kind, whether a negative, atypical, or a positive breast biopsy. Anyone who has a family history of breast cancer, and anyone who falls into a category of having prolonged estrogen exposure. And those are people who started their menstrual cycles earlier than usual, those who continued longer, those who never had their menstrual cycles broken up with a pregnancy, and particularly, I think, those who would consider taking hormone replacement.
Exactly. Dr. Schilling, when it comes to breast cancer risk management, if you had one thing to say to our viewers, our ladies out there, what would that be?
Every woman needs to know what their real risk for breast cancer is. So I would encourage women to go someplace where they have great expertise in breast cancer, find out what your level of risk is, get some counseling to see whether there's any ways that you can modify your lifestyle to reduce that risk, and then get on a surveillance plan. Currently, we recommend annual mammography for patients 40 years of age and older to help us find as many breast cancers as we can as early as possible.
Dr. Jacoby?
Yeah, I would say the same thing, is that people need to be proactive and really take care of themselves and not put themselves second.
Dr. Winsett, I'm going to end with you.
I think that everyone needs to take this test. This Brevigen risk assessment tool is the best tool that we have to find out who is at risk for breast cancer. And we can make a dent in that number of 86,000 women a year that we can prevent breast cancer, because we don't want that to be you or your sister or your daughter or your mother or your best friend.
Thank you so much, Doctor. I really appreciate everything you do. Thank you, Doctor.
Thanks.
And to you, Doctor.
I appreciate it.
And if you wish to know more about your own risk of developing breast cancer, even if you think your risk may be low, or if you'd simply like to learn more about the cheek swab test itself, which is so easy, go to Brevigen.com. That's Brevigen.com.